In today's video presentation, I will be discussing information pertaining to the coronary artery disease, basically what the disease is, its causes, symptoms, risks, diagnosis, as well as detrimental effects if the patient diagnosed with this disease refuses to seek medical treatment immediately. What is coronary artery disease? Coronary artery disease, long for CAD, results from damages to the coronary arteries. Coronary arteries are shaped like hollow tubes that function as pathways for blood flow. Let us look at an image of a normal coronary artery compared to one that is damaged or is affected by coronary artery disease. As we can see in the image on the left, the walls of the artery are normally elastic and smooth and are lined with a layer of cells known as the endothelium. This layer of cells functions as a physical barrier that divides the coronary artery walls from the blood that flows through it. The endothelium also works to release chemical signals in response to stimuli, which in turn helps regulate the function of the artery. With coronary artery disease, one can actually tell that the pathway for blood flow becomes narrow due to the clogging and hardening of the arteries from the buildup of plaques on the inner wall. This buildup of cholesterol and fatty deposits is referred to as atherosclerosis. Coronary artery disease typically develops in people at a young age, and like every other disease, if not detected and treated early, it could get worse over time. The buildup of fats around the inner walls occurs in the early stages, and then as the disease progresses, other substances that travel through the bloodstream, such as cellular waste products, proteins and calcium, and inflammatory cells start to build up as well, and those substances together with fats combine to form plaques. The most common symptom observed in patients diagnosed with coronary artery disease is angina. Angina is a medical term given to a type of chest pain that is caused by very little blood flow to the heart. People who experience this symptom explain it as pressuring and squeezing of the chest, as if a heavy weight is directly placed onto the chest. Angina is hard to differentiate from other types of chest pain, even though it is one of the most common symptoms of coronary artery disease. Angina results from a buildup of plaques inside the arteries. The arteries become narrow, blocking the blood flow to the heart muscle and throughout the body, and that in turn can cause a feeling of chest pain. Angina can cause other symptoms as well, and primarily results from when the heart is not receiving as much blood flow with oxygen as it normally does. Angina can be classified into two main types: stable and unstable. Stable angina is the type that is most predictable. It lasts only for a few minutes and gets better with rest. Unstable angina occurs unexpectedly and does not get better with rest. Stable angina is what most people with coronary artery disease experience. Studies predict that unstable angina becomes one of the symptoms as the disease progresses over time. In addition to angina, other symptoms for coronary artery disease include and are not limited to running out of breath, constant sweating, becoming excessively weak, dizziness, nausea, and even palpitations, which is the feeling of the heart rapidly bounding and skipping beats. What are some of the risk factors for coronary artery disease? Risk factors for CAD can be classified under two main categories: non-modifiable risk factors and modifiable risk factors. Some of the non-modifiable risk factors associated with CAD include gender, age, family history, and race. A lot of studies suggest that men have a greater risk of heart attacks compared to women earlier in life. However, in the later years, at around close to 70, the prevalence then levels out among men and women. Coronary artery disease begins at a young age, but symptoms are more likely to show at old age, especially those at the age of 65 and over. Another non-modifiable risk that greatly determines whether or not a person will be diagnosed with CAD is family history of heart disease. People whose family medical history is tied to heart disease are at a greater risk of developing CAD compared to those whose history does not trace back to any medical complications involving the heart. As for race, studies show that the risk of CAD is higher in African Americans compared to Caucasians, given that they have really high blood pressure than the average population. Modifiable risk factors that can be treated and controlled to prevent the development of CAD include smoking, high triglycerides and blood cholesterol levels, high blood pressure, diabetes, physical inactivity, and lastly, being overweight. Among all the listed modifiable risk factors, smoking appears to be the leading cause of CAD. Cigarette smokes contain nicotine and other harmful substances that, when inhaled, can promote atherosclerosis by causing the platelets in the blood to clump together and in turn block blood flow. Understanding the symptoms and risk factors associated with coronary artery disease, let us now talk about some of the procedures and tests that health specialists conduct to diagnose this disease. One of the most commonly used medical exams to test for CAD is an electrocardiogram, abbreviated as either ECG or EKG. This exam allows healthcare professionals to monitor the electrical activity of the heart, which include measuring heart rate and the regularity of the heartbeat. Another exam that can be used is an echocardiogram. This exam provides healthcare professionals with pictures of the heart provided using an ultrasound. Doctors can also perform an exercise stress test on their patients. This involves monitoring heart rate while the patient walks on a treadmill. By monitoring heart rate on the treadmill, the doctor can determine how well the heart is working when it has to pump more blood than usual. Other exams include chest x-rays, cardiac catheterization, coronary angiogram, and coronary artery calcium scan. Chest x-rays are used to create pictures of the heart and other organs in the chest for close observations and studies. A cardiac catheterization involves the insertion of a thin, flexible tube through the artery so that healthcare professionals can check the inside of the arteries for any blockages. Healthcare professionals can also measure blood pressure directly within the heart, as well as the strength of blood flow through the heart's chambers. Another way that healthcare professionals can study the heart for any signs of CAD would be to inject a dye into the coronary arteries and using an X-ray to detect the dye injected via cardiac catheterization. Detecting the dye is done during coronary angiogram and is used by healthcare professionals to closely monitor blockage and blood flow through the arteries. Lastly, a coronary artery calcium scan can be used for diagnosis. This exam uses a computed tomography scan or a CT scan that directly looks into the coronary arteries for any calcium buildup or plaques. Upon diagnosis, healthcare professionals would recommend several treatments to the patient. However, before we get to the treatments, let us talk about some of the detrimental effects closely associated with coronary artery disease. I have already mentioned one of the effects as a symptom. With CAD, people can feel a tightness in their chest, which I explained in one of the earlier slides as angina. Another detrimental effect is heart attack. With angina, the heart becomes starved of vital nutrients and oxygen, so the organ does not work properly. With heart attack, the blood supply to a portion of the heart muscle is cut off entirely. This means that the coronary arteries become so narrow that blood flow to the heart is obstructed. A heart attack often results from atherosclerosis, which I also described in the earlier slides as the buildup of cholesterol and other deposits in the arteries. A heart attack deprives the heart of oxygen, so as a result, the heart cells begin to die. Another detrimental effect of CAD is ischemia, which is the cramping of the heart muscle. Ischemia can be deadly as well. Similar to a heart attack, ischemia occurs when the coronary artery becomes too narrow to the point where it cannot supply oxygen-rich blood to the heart at all. Ischemia is most common during activity, exposure to cold, excitement, or stress, and can be relieved with rest and medication. However, as the coronary artery disease progresses, ischemia can occur even at the point where the body is at rest. In worst-case scenarios, coronary artery disease can even lead to heart failure. With heart failure, the heart muscle becomes too damaged and is too weak to perform its function, so as a result, it gives up. Physiological effects of CAD include depression, anxiety, and guilt. If not careful, these detrimental effects can all lead to death. Treatments for coronary artery disease vary depending on the severity and the cause of the disease. Healthcare professionals can prescribe several medications to help. Those medications as listed on this slide include nitroglycerin, aspirin, beta blockers, and ACE inhibitors. Each medication performs their own specialized function. Nitroglycerin works to help widen the arteries. Aspirin is often used to prevent clots. Beta blockers help improve blood flow, and ACE inhibitors work to help the heart recover from the damaging effects of a heart attack. There are also lipid management medications that people can take to help control cholesterol levels. If the disease resulted from modifiable risk factors, healthcare professionals might recommend lifestyle changes such as exercising and eating healthy to help keep cholesterol levels in check. Coronary artery disease can be so severe that a surgical intervention may be offered as an option of treatment. Healthcare professionals may be subjected to use an angioplasty, a stent replacement, or a coronary artery bypass graft surgery. Angioplasty and stent replacement are both procedures used to widen the coronary artery that has been blocked or has become too narrow. Angioplasty uses a tiny balloon to widen the artery, whereas a stent replacement uses a tiny wire mesh tube. A coronary artery bypass replacement is a more complicated procedure that involves grafting a healthy artery to bypass the artery that was blocked. These treatments help healthcare professionals decrease the detrimental effects of coronary artery disease and work so well to allow free blood flow to the heart so that the heart can perform its function. That concludes my presentation for today. This last slide provides references to the sources I used throughout my presentation. I hope this PowerPoint video helped provide a better understanding of the coronary artery disease and its detrimental effects. Thank you for your time, and God bless.